So we are here at the Becker's annual Health IT plus Digital Health Conference at Navy Pier, Chicago. It's a great conference with lots of interesting sessions and a lot of energy here. I'm here with Isaiah, who has about 20 years of experience in hospital equipment management at one of America's largest children's hospital in the Boston area. Isaiah, could you tell us more about what the process was like before you started with equipment management?
So we were brought in to do an analysis of the process to see where the gaps were for equipment management. And so when we came in, we noticed that 30% of the time, the nurses or the care staff weren't getting the equipment they needed when they needed it. It was also between the time they ordered to the time that was delivered, the 70% that they were getting it was taking about 2 hours for them to get that equipment. And so then we decided there's a better way to do it, and we created a process to streamline that, to build the efficiencies in the program.
And the software we built is part of that process.
Yes.
So can you tell us, it took about 2 hours is what you said, but after this process and the product, the software solution that you put in place, what's been the average delivery time, and are we still at 30% missed orders, and can you tell us more about what that was like?
So once we implemented the process, we're at 100% delivery. So every single time a caregiver asks for equipment, they get that equipment. And our average delivery time is down to 13 minutes. So it doesn't matter if it's a routine, which we have about 60 minutes to get to them, or a stat, which we get 15 minutes, we're at 13 minutes for total delivery time.
Can you tell us about the kind of equipment that are being delivered using this process?
So there's 47 different pieces of equipment, anywhere from a transportation vessel, like a wheelchair, a bed, a stretcher, to pumps, like IV pumps, syringe pumps, brains, blanket trolls, any type of feeding pump, any type of equipment that would be used for direct patient care. We manage it centrally, and then we use the software to allow nurses to stay at the bedside, order the equipment on our web application, and then we deliver it right to the bedside to the nurse so she can stay there and provide the care necessary for those patients.
Excellent. Can you tell us about how many pieces of equipment are managed, meaning how many are being ordered by the frontline staff, how many are being ordered for pickup, and how many are being ordered for sterilization through this process? How many pieces of equipment are being handled?
Yeah, so total, we're, out of the 47 different pieces that we manage, on average on a monthly basis, we're handling about 33,000 pieces of equipment. And that's equivalent to about 8,500 orders per month. And every single piece of equipment is sterilized based on manufacturer specifications. So therefore, it's ensured that when it comes to the bedside, it is safe for use, and nurses don't have to worry about cleaning that equipment. They don't have to worry about hunting and gathering that equipment. It's literally, they go on the web application, they order it. It's kind of like Amazon. They just build a basket, hit send, and it comes to us and we deliver it.
So what do you think the future holds? Right now you have the equipment being managed through the process you put in place and the software solution we developed. What do you think the future holds? Is it going to be limited to just equipment, or there's way more things that can be done through?
So the software solution that we created is, it's dynamic. It can be used for equipment, it can be used for pharmaceutical deliveries, it can be used for supply chain when you go and you're ordering supplies like bandages, packages, like slings, anything like that that's managed centrally within the hospital. It's pretty customizable. We can kind of set the parameters on what you want to put in there, and it can hold whatever you want based on SKU, based on type of supplies you want to put in there, and it all can be delivered directly to who's ordering it.
Excellent. So we really look forward to what the future holds with the kind of improvisations that can be done to the product, and we look forward to supporting you in the process.
Oh, I appreciate it. Thank you.
Thank you.